By facing the problem and treating the disease, you can manage the effects of diabetes on you and your family. There are emotional and physical aspects of treatment, but by taking action, you can minimize long-term damage. Dr. Carrie Peterson is back to talk to us about the treatments that are available for this disease.
Although there isn't a cure for diabetes, there are a number of different ways to treat the disease. You'll need to consult with your doctor for the treatment that's best for you. We'll talk about the major treatment options that are available, but first, one thing all diabetics share is the need to test their blood sugar levels. Blood testing is essential because it tells you whether there is too much or too little sugar in your blood. Now, if you don't have enough sugar, you could develop tremors or lose consciousness, but too much sugar results in organ damage and can even lead to coma. So those few extra cookies or donuts can mean big risks for a diabetic person. Thankfully, testing has gotten a lot easier, cleaner, and most importantly, less painful. Blood meters come in all shapes and sizes. The most popular meters will prick the skin, drawing a small drop of blood. The blood is tested by the machine, and in a matter of seconds, you'll see a readout of your blood sugar level. The American Diabetes Association says the acceptable range is between 70 and 130 before meals, and no higher than 180 2 hours after eating. You may want to pause here to write these numbers down for reference. Once you know your blood sugar level, you can start keeping it in the healthy range. For most type 2 diabetics, the very first step is controlling high blood sugar with weight loss and exercise. Losing weight can lessen the amount of medication you need to take and save you money on prescriptions in the long run. Controlling diabetes also requires a healthy diet, which includes keeping consistent meal times and a balance of nutrients. Since sugar can come from carbohydrates, starches, fiber, and sweeteners, it's really important to keep track of how much you're eating. But again, the absolute best way to control your blood sugar and diabetes is to maintain a healthy weight. Overweight bodies just don't respond as well to insulin. A registered dietitian can help you create a diabetes-friendly meal plan. The next step in treatment may involve your doctor prescribing medication that comes in tablet or pill form. The good news is drug therapies are constantly improving for people with diabetes. Most of these work by kickstarting your pancreas, causing it to produce more insulin. Some medications actually make your body more sensitive to the insulin that's already circulating through the bloodstream. Remember that with all medications, there may be side effects, so be sure to ask your doctor about these possibilities. Finally, when pills aren't enough, we often have to turn to injected insulin to control blood sugar. These injections are usually taken around mealtime, so the body can use that new insulin to metabolize the food you have just eaten. That can mean a couple of injections a day. While this sounds painful, most diabetics using this therapy get used to the process and routine of the treatment. Some diabetics use a long-acting insulin that only requires one injection, usually in the evenings. Keep in mind that new, innovative approaches for easing life with diabetes are always being explored, so make sure you take action and talk to your doctor about the treatment plan that's best for you.